Gambagre MLA Mehtab Sangma welcomed the state budget, calling it visionary and inclusive, with a strong focus on health, education, and infrastructure. She, however, urged the government to give a higher priority to rural connectivity, stating that nearly 200 of the 450 villages in Gambagre constituency still lack road access. The MLA also called for increased budget allocation for rural roads and greater investment in child and maternal health care to support Meghalaya's overall development.
Sir, I rise today to express my support for the budget that was given by our Finance Minister as well as Chief Minister for the year 2026-27. My deep sense of appreciation for this visionary, broad, gender-neutral, and SDG-aligned budget which covers every segment of the society. With this budget, we can see that the government of the day has clear intent to strengthen Meghalaya's growth trajectory, while at the same time it's maintaining its fiscal prudence. There is continued emphasis on the infrastructure development like roads, connectivity, power, digital expansion, which plays a vital role in integrating both our rural and urban economies. But sir, I would like to bring few important points which will affect the public in general and befit the state. Firstly, on the health department, this budget has seen an allocation of 2,472 crores, which is coming to approximately 9% of the budget, which makes us one of the highest states in the country to do so, when the national spending is only 2%. And this shows that this government is committed to give affordable and accessible health care. I had put up a lot of questions on health department, and if we go through those replies and see the details furnished in all the annexures, we can see that the health department today is progressing substantially. There has been a number of manpowers added, particularly medical officers, to the tune of about almost approximately 500. There are a number of CHCs under construction which have been upgraded, and there are a number of PHCs which are added, and so on and so forth. If we look at our health indicators, like the maternal mortality rate and the infant mortality rate, which are vital indicators of the health status of the state, our maternal mortality rate, which stood at 318 in 2021, is now at 107 in 2024, while we are still behind national average of 88. Our infant mortality rate is also on the decline trend of 34 in 2024, when the national average is 26. All this is a result of target-oriented, result-linked incentives. Well, the government has dealt in a multi-pronged approach, and there are much appreciated schemes like the Safe Motherhood Chief Minister's Safe Motherhood Program, which is much appreciated across the country. We need to still relook at the health department, and there are a number of issues still plaguing the department. Coming to the most importantly, what we need to consider is to assess the quality of the health services given today and their outcomes. Human resource is another big challenge for us. When we have seen that the number of medical officers are going up today, we still confront a number of vacancies when it comes to the specialists that are required. And it is because of this very reason there was a delay in the implementation of the Shillong Medical College and the Tura Medical College as well. And I think it's important that we take notice of this and find ways and means to address this issue, and if required, specialists needs to be on board. And hence, I request the department to look into policy issues and look into this matter. While major roads and connectivity projects are being taken up under different heads like PMGSY, state road projects, CRIF, MITP, NISITS, and other strategic projects like the Western Bypass and the upcoming Shillong-Silchar Greenfield Corridor, we still can see that rural connectivity is still very poor. I would like to give an example here of my constituency, sir. My constituency has about 450 villages, and it's all a rural populace. When I went for my campaigns, I could not even reach 4 or 5 polling stations due to the fact that there were no road connectivity. And today, as I stand as a member of Legislative Assembly here, this government has given me all the support, and every polling station has been given the sanction amount needed to connect all these polling stations. And I thank the Honorable Chief Minister and this MDA government for looking into these grave grievances as such. While this may still be the case, there are still about 200 odd villages which are still left unconnected. And this is where I want to tell the department needs to relook at the budget being given and the schedule of rates that are followed. If we follow the SOR rates, for my constituency itself, the department may need to shell out more than hundreds of crores. But these are very small, low traffic connectivity, ranging from about 200 meters to 1.5 kilometers. And to follow this SOR and sanction this amount, it may not be possible just for my constituency itself, when there are so many other constituencies also demanding the same. And I'm glad that this budget has been given this, and CM has started a program called the CM Rural Connectivity Program, where he has allocated about 43 crores. Sir, my humble submission is that this budget may not be enough and may be increased as a goal to connect each and every village. There may be so many points to ponder on today, but these are my 2 important pertinent points. While I congratulate the Chief Minister for such a visionary budget, which will lay a strong foundation for inclusive and sustainable development, and with effective implementation and responsive governance, it can accelerate Meghalaya's progress and improve the quality of life of our people. I'm sure that under the able leadership of our Chief Minister, if we are able to maintain this growth momentum, we can set an example to the country and be one of the model states in our country.